Hello family, my name is Jhovanny Castañeda. I am part of the nutrition department from Diabetes Obesity Clinic, and today we are coming with this video. We're going to talk about one of the most common questions, which is going to be the vitamin supplementations. We're going to see how we need to use them and when we need to start to take them after the procedure. I would like to clarify how vitamins will help us during this process, which is going to be to avoid any deficiency after the procedure. Besides, vitamins also help us to maintain our energy levels in balance. One other thing that we need to take in mind talking about vitamins will be it will help us to avoid any other symptoms such as dizziness, hair loss, lack of energy, etc. However, we need to take in mind that those type of symptoms will be totally normal. It's something very common that we should expect after the surgery. Eventually, those are gonna get better when we start to get more nutrition coming from actual food, but it's gonna be a slow process. Day by step, we will let you know how you need to follow the diet and when you can start to take different supplementation. I will suggest to do not focus on your vitamins or the supplements. It will be way better to focus only on your diet, and we want to see the vitamins only as a helpful tool, which is going to help us to avoid any issue in the future. Okay, family, so we already know that our goal will be to focus on the diet, and basically the supplementation that we're going to take, talking about vitamins, it's going to be only very helpful in order to avoid an excessive deficiency. However, there's a few things that we need to take in mind, and of course we can take some vitamins and minerals after the procedure done, which is going to be multivitamin complex, calcium, and biotin. Okay, family, so now we know which vitamins we need to take, but I want to clarify one thing, and it's going to be the type of vitamin that we should be taking, which is going to be the form. After the surgery, it is totally recommendable to avoid either caplets, pills, or capsules, since it's going to be a little bit hard or tough to swallow them, since most of the brands has like a large pills. So it will be way better to switch them for another type of form. It could be either patches, liquids, or you can do powders, and those will be totally fine. Okay, so talking about the vitamin complex, any brand will be okay. As long as you use the recommendable forms that we talked before, will be perfect. The vitamin complex contains the whole vitamins overall. Now, the dosage that we recommend to use will be once a day. You can follow the brand recommendation and will be perfect. As long as you take your supplementations with your diet, it will be fine. Once a day, that will be your goal. Okay, secondly, we're gonna talk about calcium. Calcium basically will help us to avoid a bone deficiency. Okay, of course, that means that we need to take the calcium by itself along with the vitamin complex that we're going to be taking. Usually the recommendation is to take between 1200 up to 1500 milligrams per day. Most of the brands that we're going to find in any pharmacy store will suggest to take either 15 milligrams or 16 milligrams per dosage. That means that we're going to be able to take either 2 per day or 3 per day, depending on the brand. Now, we will talk about biotin. Biotin basically will provide protection to your hair and nails. Okay, it's fine. You're gonna be able to introduce in your daily basis, and it will be totally fine. Actually, the recommendation is to use around 10,000 milligrams per day. Just one dosage during the whole day. However, I just wanted to clarify one thing. If we want to use biotin as a supplement in order to avoid the hair loss process, that won't help at all. Biotin basically is a tool in order to avoid an excessive loss of hair. However, it will be part of the process, so do not for yourself, but feel free to introduce into your diet. So now, there's another thing that I would like to talk, and it will be collagen. There's a lot of questions regarding collagen, and usually it's not recommendable to use this supplement either before or after the procedure. Why? Because it promotes the risk of internal bleeding that I will be talking before the surgery. So it will be super important to, if you are taking this supplementation, it will be way better to discontinue 2 weeks prior to the surgery, and after the surgery you must wait between 4 up to 6 weeks. It will be depending on your healing process, so just stay away for collagen. If you have any question about it, please feel free to let us know. Now, how do you take them? Actually, it's not necessary to use or follow any schedule. It's not necessary at all. You can follow the recommendation of the actual brand and it will be great. However, we will suggest to divide them throughout the day. For example, if you're going to take your vitamin complex during the morning, you have to take it before your meal, and you have to wait after the meal to take the calcium. The other take it will be during the noon. It's going to be the same example, before and after your meal. Talking about the last one, it will be before you go to bed, which means only calcium. If you like to introduce biotin, you can wait until you go to bed as well, and it's going to be only once daily. So that will be it, family. Thank you very much for having the time to see this video. Do not forget to follow us on the social media and subscribe to the YouTube channel. Have a good one. Take care.